Am I audible? Is my screen visible? So in today's session, we'll do the chapter of iodine, chapter 13, page 251. Please check the new textbook as well if it is the same page number. It's 256 in the new textbook. So introduction, iodine, it is a trace element. So it's a micromineral trace element, okay? Naturally present in some food. It is fortified into salts, okay? And it is also available as dietary supplement. The iodine that you get from plant-based sources is very less, okay? It's the bioavailability of iodine from plant-based sources are very, very less. It's almost impossible to get the iodine element specifically from plant-based diet. So salt fortification was one of the key option. So total body contains around 15 to 23 microgram of iodine, and 80% of this, majority of the iodine in your body is in your thyroid gland, okay, to synthesize the thyroid hormones. So in absence of proper dose of iodine, hypothyroidism can take place, okay. So muscles, salivary glands, ovaries, they also contain some amount of iodine, but the majority of it is present in your thyroid gland. And even within your circulation, in your blood circulation, okay, free forms of iodine do occur. Protein bound iodine is also present. So free form of iodine and an iodine mineral bound with a protein molecule. Okay, in these two forms, iodine is available in a very trace amount in your blood circulation. Okay. Coming to the function of iodine, the most important function of iodine in the body is the synthesis, production of thyroid hormones. Triiodothyronine, T3, okay, and T4 tetraiodothyronine, okay. These names come from the molecules of iodine that is present in this hormones, okay. So in T3, triiodothyronine, 3 iodine molecules are attached to the thyronine substance, and that's a hormone, okay. And tetraiodothyronine, 4 molecules of iodine, okay. So that is the main difference between T3 and T4, okay. And these influence majority of your metabolic function, your growth and development. In adults, majority of the metabolism, okay, if you say your metabolism is low, which means you have a thyroid gland which is not that active, okay, it is not active, or you may be lacking iodine in the in your diet, okay. There are other names also, okay, there are different names for these hormones, okay. When we use the word tetraiodothyronine, okay, understand it is thyroxine, okay. There are other names also, but just just to make you understand why these names have come into, what is the main difference between these two hormones, it's the number of iodine molecules that is attached to the thyronine molecule, okay. You can call it thyroxine as well, okay. But when you call the name of tetraiodo, you will understand the meaning of this molecule by the name itself. So for normal development, normal growth and development, these thyroid hormones are very important. They also help in the proliferation of your brain cells, that is, increase in the amount of brain cells. And specifically for pregnant women, okay, during the 4th month of the intrauterine life, okay, thyroid hormones are important. And those who suffer from hypothyroidism over a period of time, children as well, they may produce insufficient development in the brain, okay, impairment in the brain function as well, because as we know, thyroid hormones are required for the proliferation of brain cells. Proliferation means one cell will break down, will divide and form 2 cells. 2 will go into and form 4 cells, 4 into 8, so forth. Okay, that is called proliferation of cells. And thyroxine, that is tetraiodothyronine, T4 hormone, is very essential for reproduction. So these all are the essential functions, key functions of thyroid hormones within your body. First is to increase the brain cell proliferation, that is, increase in the number of brain cells, convert carotene into vitamin A. Carotene is the, iodine deficiency in the mother may lead to an infant who may be born with mental retardation or brain insufficiency. Okay. So thyroid hormone can help convert carotene into vitamin A. Synthesis of protein, absorb carbohydrate. Synthesis of T3 and T4 iodine is required. Regulate growth and development of hormones, that is your growth hormones. Stimulate metabolic rate by 30%. In the absence of iodine in your food, even if iodine is available in the food, if its bioavailability is low, your metabolic rate will come down by 30%. Okay. Normal development of brain for reproduction. Okay, so these all are the essential function of iodine. Is it clear so far to all? The basics of iodine. Coming to the absorption and metabolism. So you get iodine from the diet, okay? Majority of your iodine requirements are fulfilled by your table salt, iodized table salt. And it is directly absorbed through your intestine, okay? Active transport will take place since it is a mineral. Active transport, direct absorption can take place specifically in your small intestine, okay? And automatically, since it is a mineral, okay, it will be getting distributed in the extracellular fluid of your intestine as well. And then from there, it will go into the bloodstream, okay? So direct active transport of iodine will take place. And once it is in the intestine, in the small intestine, after that, through the extracellular fluid, it will enter into the blood circulation. And from the blood circulation, it is in the form of inorganic iodide, or sometimes it will be bound to a protein. Okay, in both the forms, iodine is able to travel through the blood. Okay, and whatever iodine your body has absorbed, less than 5% of it only that will go into your thyroid gland. Majority of it, 90 to 95% of iodine, majority of it will be excreted out of your body through urination. Okay, it will go into the kidneys and it will be filtered out of your kidneys. Whatever iodine you get from your diet, less than 5% of it is what your body is actually keeping, that is in your thyroid gland. Remaining of it is being excreted out of your body. Okay. As soon as iodine will pass through the kidney, it will be excreted. And not just through your urine, even through your sweat. Okay, when you sweat a lot, even through your feces, okay, your bowel movement, iodine will be excreted out of your body, because that is your body's mechanism in place to make sure that you don't lead a level up to a toxic level of iodine. Okay, you don't go to a toxic level of iodine. So your body has this mechanism to excrete maximum iodine out of your body. Less than 5% of the absorbed iodine will be transferred to the thyroid gland for the synthesis of T3 and T4 hormone. So before the T3 and T4 hormones are produced in your thyroid gland, okay, before that, there has to be secretion of thyroid stimulating hormone. Okay, so first your hypothalamus and the pituitary gland are positioned between inside your brain. Okay, so hypothalamus, that will secrete thyroid releasing factor TRF, or it will secrete thyroid releasing hormone. And because of this TRH hormone, okay, it will trigger your pituitary gland to produce and release TSH hormone. What is the full form of TSH? Thyroid stimulating hormone. Only if TSH is produced and released, it will stimulate. From the name itself, you will know the meaning, thyroid stimulating hormone. Okay, so it will stimulate the thyroid gland to produce T3 and T4 in the presence of iodine. Okay, not just the presence of TSH will lead to the production of T3 and T4, even though if your body has healthy amount of TSH, okay, if it is, there is a healthy amount of TSH, but if the thyroid gland does not have enough amount of iodine, T3 and T4 will not be produced. Okay, so when you do a blood test, TSH levels are also checked, thyroid stimulating hormone levels are also checked. If it is too much, if there is too much of thyroid stimulating hormone, it could mean that you may have hypothyroidism, because since the thyroid gland is not producing enough amount of T3 and T4, what the body will think, let's push more TSH, let's make more TSH hormone, at least then the thyroid will start producing some thyroid hormones. Okay, so that's the reason why people who have hypothyroidism, they will have high increased rate of TSH hormones in their blood circulation, but decreased rate of T3 and T4. It means that body is trying to produce more hormone, thyroid hormone, but it is being unsuccessful. Okay, is it clear about T3 and T4 production? TRF is thyroid releasing factor. TRF means thyroid releasing factor. So it hypothalamus kind of will check if your blood has enough amount of thyroid hormones or not. Thyroxine levels in your blood will be checked by your hypothalamus. As soon as the hypothalamus will sense that thyroxine level in your blood has fallen down, it will release TRH, thyroid releasing factor, okay, or thyroid releasing, thyroxine releasing hormone. Okay, so that will trigger the pituitary gland to produce and release TSH. What is the full form of TSH? Thyroid stimulating hormone. And then TSH will interact with the thyroid gland. In the presence of iodine, T3 and T4 will be secreted. So hypothalamus has to check always. Hypothalamus is always it is vigilant. What is the thyroxine levels in your blood? Okay. As soon as the thyroxine levels in your blood falls down, that is the T4 levels in your blood, it falls down. It gets the message that TRH, thyroxine releasing factor has to be released. Figure 13.A will have lot many medical terminologies which is not required. You just have to understand this basic concept which is shown on the slideshow. Figure 13.A is too technical, that is for the medical students. Okay, it is not required by all. Those who are from various other backgrounds, you only require to know this function, this concept. Okay, hypothalamus to produce T3 and T4, these two thyroid hormones. All these mechanisms are involved. Only that's what you should know. Okay. Hypothyroidism has various stages. Okay. In some stages, you will have normal TSH levels, but your thyroid may be secreting less amount of T3 and T4. Okay, it can come in various forms. Coming to the RDA, recommended daily allowances. So around 50 microgram to 1000 microgram is the required amount based on the different age groups as well. Okay, it's microgram mg. Okay, during pregnancy and lactation, iodine requirement increases. Okay, if the mother has less iodine in her diet, breast milk will also have reduced iodine. Okay, so in lactation, that is the highest, during lactation, highest requirement of iodine has to be maintained. And also the amount of iodine that you excrete in your urine, how much you have lost, you have to maintain that. Because we have seen 90 to 95% of iodine that your intestine is absorbing, it is directly lost from your body. Hardly 5% is kept back in your body, that too in the thyroid gland. Majority of it will be in the thyroid gland. Some 1% or 2% will be available somewhere else. Okay. Adults, a normal adult man would require 140 microgram per day. Pregnant women to lactating women, 220 for pregnant women. Lactating women will have 280. Please check your textbook, new textbook, if the numbers are same or not. If there are any new numbers, please mention in the chat box. The textbook that I have, it has ICMR 2020 details. Okay. So if you have ICMR 2022 details, you can mention that. I think it is the same, those who have the new textbook. The RDA is same. RDA for iodine has not changed. And definitely there is an upper limit of iodine intake. Okay, too much of iodine intake is harmful. That too much of iodine can also inhibit the synthesis of thyroid hormones. Okay, too less and too much, both can lead to, both can affect the synthesis of thyroid hormones. And the name of the thyroidism, hypothyroidism, is called Wolff-Chaikoff. Okay, those who have the textbook, please mention the page number. In old textbook, it's on 253. Just because of less iodine in your diet, if you are getting hyperthyroidism, hypothyroidism, it's called Wolff-Chaikoff hypothyroidism. Okay, I have mentioned in the chat box the spelling of it. specifically if any pregnant woman, just to make sure that she's on the safer side and she does not get iodine deficiency during during her pregnancy. If she indulges in large doses of iodine, if she has took iodine supplements, iodine rich food and all, okay, in large sources, if she has ingested iodine, Wolff-Chaikoff hypothyroidism usually will take place to the newborn child. Okay, as I mentioned, too much of iodine can also lead to hypothyroidism, and that is called Wolff-Chaikoff hypothyroidism. Okay. Symptoms would be similar to hypothyroidism. We will discuss that later. Coming to the sources of iodine. So rich sources of iodine are your seafood. Okay. Sea water itself is rich in a lot of minerals. Iodine is one of them. And also any vegetations or any plantations that you grow in coastal areas will have more iodine content as compared to any vegetations or plantations you grow in the hilly areas. Okay, because hilly ranges, mountainous ranges, every year when rainfall happens, okay, uh, these hilly ranges and mountainous ranges will undergo landslide, soil erosion. Okay, soil erosion is very common in mountainous ranges. Okay, so the soil will lose its iodine and other trace minerals on a annual basis. So that this kind of cycle is not seen much in coastal areas. So coastal areas, the soil in the coastal areas or the areas near to the coastline, okay, they are able to retain their mineral quantity better. Okay. So seafood, any form of seafood is a rich source of iodine. Eggs, dairy products, vegetables, iodized salt. Okay. Every 100 gram of fish, any fish that you consume, any seafood that you consume, okay, every 100 gram of it may contain around 28 to 55 microgram of iodine. And obviously, seawater fish will have more quantity of iodine as compared to freshwater fishes. In egg, around 50 microgram per 100 gram. Every 100 gram of eggs will have 50 microgram of iodine. And that too, in the white, egg white has more of iodine, not in the yolks. Coming to iodine deficiency disorder, earlier it was goiter, but now the name has changed. Now it is iodine deficiency disorder. And goiter is one type of iodine deficiency disorder. Okay. It depends on what kind of egg you are using. Okay, desi eggs and all are smaller in size. And also during cooking, okay, when you process the food a lot, too much of boiling and all, iodine will be lost. Okay. Frying a food will reduce the iodine content by 20%, grilling by 23%. And if you boil something and you throw that water out, you're boiling potatoes, you're boiling any vegetable, and you throw that water off. Okay, strain the water off, you are losing 58% of iodine. Okay, so by different methods of cooking will also impact the iodine content in your food. Okay. So coming to iodine deficiency disorders, and those who have the textbook table 13.2 on page number 256, new page number you can mention in the chat box. A table is given of cereals, plant-based foods. Okay, how is the goitrous and the non-goitrous regions? How much iodine they contain? Okay, goitrous regions means all the hill ranges. Okay, all the hill ranges in each and every states of India. Every states of India has hill ranges, right? You pick any state or any union territory, they have their hill ranges. They have, some states have the coastal line as well, not all states. Okay, so as I mentioned, iodine content will always change from where you are residing in or from where you are procuring your food. If you search in Google about the goitrous regions in India, you will find a list of states. Usually it is the Himalayan regions, Uttarakhand, Uttaranchal, okay, Jammu Kashmir. All the Himalayan ranges are known for its goiter rates, and all the other hilly and mountainous regions in any state of India, okay, they also have risk of goiter. So about 1.5 million the population in the world are at risk of IDD. Out of that, it is 1.6 billion, okay, not million. And out of that, 200 million population is just from India, okay. It is 1.6 billion population in the world is at risk of iodine deficiency disorder, and 200 million is in India only, okay. In developed countries, the problem is eliminated through awareness and control programs. They fortify a lot of their food. Okay, in India, salt fortification is done. In France and all, they have fortified their oils as well. Okay, so different countries have their own strategies, but in all the countries, almost all of the countries, salt fortification is a very common practice. Okay, in India, by law, okay, by law, you have to fortify the salt. Any table salt, if it is sold, it has to be fortified. Okay, nowadays they follow double fortification, not just iodine, but iron is also put into the salt. Okay, goitrogen, goitrogen is the causative element that causes goiter. Okay, goitrogen is any element that will not allow iodine to function or be absorbed or function properly. That is goitrogen. It is like anti-iodine in its act. Okay, it is kind of a villain to for iodine. Okay, so prevalence of goiter among 6 to 11 years of children was about 4%. Highest was in Maharashtra and in West Bengal. And in India, if you take the endemic belt of goiter, all the Himalayan range, foothills come under the goiter belt. Okay, Aravali Hills in Rajasthan, Sub-Vindhya Hills of Madhya Pradesh, Narmada Valley in Gujarat, all the hilly areas of Odisha, Andhra Pradesh, tea estates, people who stay in the tea estates of Karnataka and Kerala, districts of Aurangabad, Pune, okay, Koli Hills in Salem. So they all are the goiter belt of our nation. But people who inhabit the coastal areas in India, okay, the coastal population, the fisherman community and the coastal population, they are free of goiter. So etiology, causes, why does IDD takes place? First is the environmental factor. So environmental factor, as I mentioned, in these hilly areas, whenever there is high rainfall, high snowfall, flooding. In valleys, you will see flooding. Okay, valley means what? There are two hills. Okay, when and there is a place in between two hills. Okay, that becomes a valley. So usually the rivers and all they flow from the valley. And whenever there is heavy rainfall, definitely there will be flooding. And when there is flooding, soil erosion will take place. And along with soil erosion, a lot of iodine content from the soil will be lost. Okay. Vegetarians have higher risk of goiter. Non-vegetarians and fish-eating communities, they don't. Vegetarians have a higher risk of goiter. Because as I mentioned, bioavailability of iodine from plant-based food is very low. And on top of that, if you're not using iodized salt, your risk will increase. Okay. And if you're using water from deep wells, that will also have a source of iodine. But in conclusion, no state in India or no union territory in India is free from iodine deficiency disorder, because some or the other way, some or the other environmental factor has always affected the agriculture, okay, in India. Intrinsic factors, goitrogens, as I mentioned, that is also extrinsic, because it is not something that is happening inside your body. Goitrogens are present in food, okay? They interfere with iodine metabolism and absorption, as I mentioned. So, goitrogen is kind of a villain for iodine. In the presence of goitrogen, iodine metabolism and absorption will be affected negatively, okay? Rock salt is not an iodized salt. Rock salt, pink salt can be iodized, okay? But in its raw form, in its natural form, rock salt and pink salt are not iodized, okay? But when you buy it from manufacturers, okay, and if they have mentioned they have fortified it with iodine, then it is safe to use. Common, see, the thing that is common between salt, black salt, and pink salt is more than 90% of its content is sodium chloride, NaCl. Okay, just 1 or 2% of it, that is the only difference that it makes in terms of flavor, taste, and the presence of other ingredients. In black salt, sulfur ingredient is more. In pink salt, some other trace minerals are found. But you only require one teaspoon, 1 tablespoon of salt throughout your day. Okay, so just to get these trace minerals apart from sodium chloride, if you are hanging on these trace minerals and you are using black salt and pink salt, you are avoiding common salt. You are neither getting those trace minerals and you are losing your chance of having iodine. Okay, so in my opinion, if you want to add a flavor profile to your food, if you want to just if you're making a salad or something and you just want to sprinkle some colorful salt on it, flaky salt, flakes, a black salt has a sulfuric flavor to it, so like chaat masala kind of a flavor to it. Okay, just for that flavor profile you can use these things, but don't don't exclude common salt. Common salt should be the basic salt that you use throughout your day. Whenever there is an occasion you want to decorate, you want to add some extra flavor profile, okay, or you want to put if the salt is less, if the salt is less in the food and you want to garnish the food with some pink salt, or you want to keep pink salt on your dining table as a decoration purpose, so that if salt is less, if you want to add more salt in the food, you can use the pink salt. Okay, so like that you can use it. Microplastics are present everywhere, not just in sea salt. Microplastics are present in whatever food you eat. in whatever non-vegetarian, plant-based, whatever you eat, okay, microplastics are present everywhere. Okay, how much ever organically you are using it, see, the water, soil, air, everything is polluted by microplastic. Okay, you can't get rid of it. Only if you are getting your soil from dense Amazon forest, which was not at all inhabited by any human. Okay, in the past 50 uh, years and all, no humans have inhabited a specific land, and you're getting your soil from that land to grow your kitchen garden or crops. Only then you can be sure, that also not 100%, you can be assured that microplastic will not be there in the food that you consume. Otherwise, everything, all the agricultural department, okay, all the large scale agricultural departments, wheat, rice, everything, okay, will have microplastic, because the abuse of the land we have done, the abuse of the plastic abuses that we have done all through these centuries of years, it will show its effect like this. Okay. So goitrogens, there are different classes. No need to study that. Just understand the meaning of goitrogen. They interfere with iodine metabolism. And cruciferous vegetables, we say those who have hypothyroidism. Hypothyroidism, okay, they have to avoid cruciferous vegetables. Doesn't mean completely stop having no cauliflower at all, no cabbage at all, no broccoli at all. Not like that. You can have it once a week, you can have it. Okay. Those who have hypothyroidism, once a week or twice a week, you can have cauliflower or cabbage or broccoli. But on a daily basis, avoid cruciferous vegetables. Okay. Daily basis, 2 times a meal, avoid cruciferous vegetables. Those who have hypothyroidism. That's it. Okay. Soy also, soy products as well. Even tapioca, cassava, tapioca, groundnuts. Okay. Bamboo shoots, peaches, almond, sweet potato, okra, that is bhindi, ragi. Okay, the goitrogens are present in all these food items. You can't completely eliminate all this from your diet. You will have to take it in some or the other way. Okay, so reduce the rate of consumption of it. Don't completely avoid them. Okay, take the hypothyroidism treatment, whichever form, allopathy, Ayurveda, homeopathy, whichever form of hypothyroidism treatment you want, take it. Okay, but reduce the consumption of cruciferous vegetables and other goitrogens. Intrinsic factors. Why does goiter or iodine deficiency disorder is taking place? Because of things that is happening within your body. That is intrinsic factor. Okay. Any congenital issues you may have. Okay. Any child may be born with some issues in their hypothalamus. So TRF will not be secreted properly. Pituitary gland is not functioning properly. So TSH will be not secreted. Okay. A child is born with an underactive thyroid gland. Okay. So that could also lead to goiter or thyroid dysfunctions. Stillbirth can also be a result of uh, iodine deficiency during pregnancy. Stillbirth means a child who is born lifeless, child who was born dead. Okay, that is stillbirth. So spectrum of iodine deficiency disorder. Spectrum means in different age groups how it affects. Okay, so IDD will not just affect your adults or children. From your birth itself, some or the other symptoms will be shown in you if you are deficient in iodine. Okay, so if you are in a fetal stage, okay, inside the mother's womb, okay, your thyroid development, if the mother is deficient in iodine, the child will not develop the thyroid gland properly. Okay, underdeveloped thyroid gland. The child will be born with hypothyroidism. Okay, so from the fetal stage onwards, iodine deficiency will have some effect. In some case, the child is born dead, stillbirth. Okay, that is stillbirth. The child is born dead. In childhood, if the child has iodine deficiency disorder, brain will not function properly. Okay, mental retardation, brain cells will not proliferate, memory issues, any congenital abnormalities may take place. Abortions can happen when a woman is pregnant and she is deficient in iodine. Okay, spontaneous abortion, that is miscarriage. Okay, miscarriage is also a form of abortion, that is spontaneous abortion. Okay, it happened on its own, it was not induced. Stillbirth, as we mentioned, child born lifeless. Congenital anomalies to the child. Okay, underactive thyroid gland, increased rate of death for the newborn baby. Cretinism, I'll show you the signs and symptoms of it. Psychomotor defects because brain cells are not evolved properly. When the child is born as a neonate, the child will have goiter. The child will have hypothyroidism, symptoms of hypothyroidism. Children can also suffer from goiter, juvenile hypothyroidism, impaired mental function, IQ that is less than 15, IQ less than 15, low performance in school, retarded physical development as well, not just mental, physical as well. In adults, reproduction issues, goiter, hypothyroidism, impaired mental functions. Okay, this can happen because of iodine deficiency. So cretinism, there are two types of cretinism, neurological and myxoedematous cretinism. Before that, goiter. Goiter is not cancer, okay? You see a big lump here. No, autism is not the reason of iodine deficiency. The autism is a genetic condition. It's because of the genetics, okay? Something that has gone wrong with the DNA mutation. That is what leads to autism. So goiter, there is a big lump in the throat, but it is not cancerous. Okay, it is non-neoplastic, which is non-cancerous. It is not inflammatory as well. Okay, it's just the enlargement of the thyroid gland. Okay, because thyroid hormone is deficient, thyroid gland is not producing enough thyroid hormone, but there is too much of TSH released. As I mentioned earlier, your hypothalamus is always having a vigilance that thyroxine levels in your blood has gone down or not. Okay. When there is no thyroxine, T4 is not being released by the thyroid hormone, thyroid gland, the body will think there is no thyroid hormone being secreted. So hypothalamus will become overactive. It will secrete more TRF, thyroxine releasing factor. Because of that, pituitary gland will also become overactive. It will dump a lot of TSH, thyroid stimulating hormone. What does a thyroid stimulating hormone do? It, some way or the other, it has to make the thyroid gland make more thyroid hormone. Okay. So what it will do, it will, because of thyroid stimulating hormone, the cells in thyroid gland will increase in number and size. Okay. Because what the thyroid hormone gland is thinking, if there is more cells, more hormones can be produced. Okay. And if there are bigger cells, more and bigger cells, more hormones can be produced. So in that way, thyroid hormone will increase the number as well as the size of the cells. That's how you get this enlarged thyroid gland. That is quite visible. Okay. So that's how you get goiter, because of excessive TSH, thyroid stimulating hormone. and still the thyroid hormones will be less in number. Even though you can see here, the gland is this big, okay, it's a big thyroid gland, but still it is underperforming, okay. Once you start giving the patients appropriate dose of iodine, slowly over time, the enlargement will come down. There will be a reduction in size. In some cases, surgically, you will have to take a piece of the thyroid gland away, okay? And it is more common in girls, in women, as compared to men. Is it clear about goiter? This is how it is. Normal thyroid gland, the size of it, once it has been affected by too much of TSH, enlarged thyroid gland, which we call as goiter. Okay. So incidence, it is more common among adolescent girls, young adults, school-age children, more in females than males. Cretinism. So congenital iodine deficiency. So this is intrinsic. Cretinism is intrinsic. Okay. Congenital iodine deficiency. A child who is born with iodine deficiency. Okay. This condition is present at birth. It is marked by physical as well as mental development is retarded. Retarded physical development, retarded mental development as well. Okay. Because there is insufficient iodine production and thyroid hormone production. And these are the signs and symptoms of cretinism. Hair is dry, coarse, sparse, and it's not much pigmented. Okay. Lateral eyebrows that are very thin. Okay. The sides of the eyebrows are very thin. Periorbital edema, that is the orbital region, that is the orbital bone is the bone that surrounds your eye. Okay. So that complete area has swelling, periorbital edema. Puffy, dull face with dry skin. Sometimes the child will be mute, deaf. Okay. Some children will have paralysis on their legs. Okay. So there's a spectrum of symptoms that you see in cretinism. Okay. And clinically, there are two types of cretinism, neurological and myxoedematous cretinism. We'll see the difference between that soon. So two main reasons for cretinism: lack of thyroid gland. Either, as I mentioned, if the mother is deficient and while she's pregnant, if mother is suffering from iodine deficiency, the child will not develop a good thyroid gland, a healthy thyroid gland. Okay, and then the child will have cretinism. Failure of thyroid gland to produce thyroid hormone and thyroid iodine deficiency in the diet. So neurological cretinism, in that the child will suffer from mental retardation. Okay. Child may be deaf, mute, will have squint eyes. You can see here the child has a squint eyes. And diplegia, spastic diplegia, rigidity of the lower limbs. Reflexes are not normal. Usually a child is born with specific reflexes. Here the reflexes are not normal. Stunting means small in height. Height does not grow. Brain development will be affected. In myxoedematous cretinism, in the name itself, myxoedematous, swelling is there. Okay. All the signs and symptoms of hypothyroidism you will see here: dry skin, coarse skin, tongue is swollen, voice is deep and very hoarse in sound. Okay, they will have apathy, don't have any empathy towards anyone. Okay, very rigid, irritant behavior, mental deficiency. Sometimes they could be deaf and mute as well. They may suffer from goiter as well. And myxoedematous cretinism may take place in the later stages of pregnancy. During the last trimester, if the mother is uh, deficient in iodine, myxoedematous cretinism may take place. In the early stages of pregnancy, if the mother is iodine deficient, neurological cretinism will take place. Okay. If in the first trimester or the second trimester, if the mother has iodine deficiency, the child born to her will have neurological cretinism. But in the last phases of pregnancy, if the mother was iodine deficient, it will lead to myxoedematous cretinism. So these are the symptoms, the same thing which I repeated. Neurological, retarded growth, deaf, mute. Motor spasticity means the motor functions is not proper. Reflexes are very quick and high. Mental retardation with squint eyes. Myxoedematous cretinism. Again, retarded growth. Incomplete maturation of facial expression. Dry skin, thick skin, small dry hair, small ashes, eyebrows. Eyebrows are very thin and small. Mental retardation, but comparatively the lesser intensity as compared to neurological. Okay, the intensity of mental retardation is less. Delayed sexual maturation once the child grows. And all the other clinical manifestation of hypothyroidism is also seen here. Okay. Hypothyroidism, underactive thyroid gland, when the thyroid gland does not make enough amount of thyroid hormone to meet the body's requirement. Very common in adults. In women, it is more common as compared to men. So there are some symptoms of it: dry skin, coarse skin, husky voice, deep husky voice, delayed tendon reflexes. Okay. When you do the blood test, you will find T3 is, T4 is low. T3 could be normal, sometimes it is low, but TSH is high. Okay. When TSH levels is high, T3, T4 is low. Sometimes T3 gets lower later, but in the initial stages, T4 becomes low. Okay. But TSH levels are high because pituitary gland is trying to stimulate more, using more TSH hormones. More and more TSH hormones are secreted by the pituitary gland to make the thyroid work. Okay. But it is unsuccessful. So that's the reason why you have elevated high TSH levels, but low T4 level, normal or low T3 level. So that is the diagnosis of hypothyroidism. When you do a blood test, that's when you get these results. Okay. Psychomotor defects in hypothyroidism, your IQ score will be less. Your motor coordination, hand-eye coordination, arms and feet coordination, okay, that is also poor. Some people may just suffer, they may not suffer from any of the above mentioned disease conditions, but they have impaired mental function. That is also because of iodine deficiency, reduced mental function, low intelligence levels, apathy, not having an empathy towards anyone. Okay, that is apathy. Lack of initiative or decision-making capacity. So these are also the different types of iodine deficiency disorder. Earlier, iodine deficiency was only goiter, but no, now there is a range of diseases that can take place because of iodine deficiency. So prevention. we have the National Iodine Deficiency Disorder Control Program. Earlier, it was called the National Goiter Control Program, but the name was changed later. Now it is National Iodine Deficiency Disorder Control Program. Since the year 1960, it is active. It was National Goiter Control Program. Later, it is IDD program. Since April 1922, it is implemented by the Department of Health, by Government of India. So the production of iodized salt, okay, it is liberalized by this because of this program. It also ensures that all the manufacturers, salt manufacturers are iodizing that salt. Everyone has access to iodized salt. That is important. Okay. Just by producing iodized salt, you will not solve the problem. Okay. Your population should also be able to access it. They should be able to buy it, which means even in the ruralest area of India, okay, shops which are in the most rural areas of India, they should also have the opportunity to sell iodized salt. Okay. So iodine fortification was an objective of this program. Conduct surveys on a regular basis, specifically in the Goiter belt region of India, the Himalayan regions, okay, and all the mountainous regions, hilly ranges throughout the country. Okay, they keep an eye out for the rate of goiter they are seeing, the rate of iodine deficiency disorders they are seeing on a annual basis. Okay, keep a survey of that. Make sure iodized salt are being supplied, not common salt. Okay. Every 5 years, resurvey is done. Checking the laboratory, checking the reports, auditing the laboratory, how many hypothyroidism cases we are seeing. Okay, how many goiter cases we are seeing. Okay, that laboratory monitoring is also done by this program. Health education, publicity. In medias, if you have seen the importance of iodine deficiency, importance of iodine fortification, it is because those advertisements are done by this program. Training all the states in doing the surveys. Establishing goiter control cells, IDD control cells in all states and union territories. So these all are the objectives and planning of NIDCCP programs. So components, we have iodine fortification. So you can't fortify anything. When you are fortifying a food, you have to make sure that this particular food is consumed by everyone in the population. Okay, religion, class, creed. Okay, it has no bar. So salt is that kind of a food. Okay, which is used by every class, every religion, every state of our nation. Everyone uses salt. So salt is the best item that could be fortified. Socioeconomic status of a person does not affect their salt consumption. Okay, it should be accessible and it should not be expensive. Okay, so that kind of food is used for fortification, like oils, attas. Okay, cereals, pulses, grains, legumes. These all can be fortified as well, because it is used by everyone. A majority of the population uses rice, wheat, attas, and all those things. Oils as well. Nowadays, we have double fortification, as I mentioned earlier. Iodine and iron deficiency, both are targeted with just one single step of double fortification. Iodized oil is also available, but in France, it is used usually poppy seed oil. Okay, these are fortified. Iodized water, even drinking water, you can fortify it, you can iodize it. Mineral water or municipal water available for drinking. Portable water, if the source is quite big and your population that you reach from this particular source is vast, you can iodize the water as well without changing the flavor, texture, or the main component of the food that you're fortifying. Okay, adding iodine into salt, adding iodine into oil or water, it will not change the taste of these elements. Okay, so that is very important. Monitoring and surveillance, as I done, the laboratories and the program will do the monitoring and surveillance every 5 year, and annual surveillance is also done. Training the manpower, ASHA workers, community health workers, okay, in the selecting and treating the cases of goiter. Mass communication, that is using your media, television, radio for communicating the health education, awareness of iodine deficiency to the masses. So that's about micromineral iodine. When access is taken, again, it could lead to Wolff-Chaikoff hypothyroidism.